Hi, everyone. I'm going to go ahead and get started because I think we have most of the people that will be here. Thank you all for being here today. I'm excited. We're going to do, I know they were calling it like a guided meditation, but really what we're going to do is we're going to do what I think is some really cool hypnosis for today. And so we're going to be working on a couple different things, and I'll talk about those with you briefly before we get started. So we're going to be doing some hypnosis today that is really focused on the mind-body connection because our brain sends signals to the rest of our body. And like I've mentioned, if you've probably seen any presentation that I've given, when our brain feels that it's in danger and it releases cortisol, all the blood flows up there and away from our organs, leading to tension, inflammation, pain and discomfort. And if the blood is flowing away from the reproductive organs, they're also not working to the best of their ability. So because of that, it's really, really important that we start to have that body going back and forth. And so what we really want to focus on is finding ways to reconnect with our mind and body so that those signals are not misfiring and that our body and mind doesn't consistently feel that it's in danger due to fears that it has instead of what's actually going on with ourselves. So what's today going to look like? We're going to do some brief mindfulness just to get us centered, and then we're going to do hypnosis. This will focus on healing the different parts of ourselves that we feel like need healing on this journey, focusing on that validating voice that we've talked about over the last 2 weeks so that we feel like we have a little bit more control over our thoughts and feel more empowered moving forward, validating ourselves, and continuing to work on increasing that confidence. And then we'll kind of see where we're at and how much time we have left today. So you can go ahead and get nice and comfortable. Like I said, we'll do a brief meditation to kind of ground us into the moment, but we're also going to do some hypnosis. And so for that hypnosis, you can just find a comfy spot. You can get nice and cozy. Close your eyes if you want. I'll tell you when to do so. There's no right or wrong here. And I can't preface that enough because I have a lot of clients when we do hypnosis that will say, I think I'm doing it wrong. Or how do I know I'm doing it right? There is no right or wrong here. But what I love about hypnosis compared to a meditation is often when you listen to a meditation, it might say, if you notice your thoughts, bring them back. I don't want you to do that with hypnosis. Your thoughts will likely wander, and that is absolutely normal. What it does is it tells me that the metaphors I'm using and the suggestions I'm making are bypassing that conscious because you're feeling relaxed enough that I'm able to send those all the way down to that subconscious, which often is where those beliefs come from. And so those beliefs can often lead us to have these negative beliefs about ourselves, about our experiences with fertility, with work, with relationships, whatever they might be. And so just know that if you notice your thoughts wandering away from things, or you suddenly feel like you heard part of what I said, but my voice is going in and out and you're feeling a little tired, know that that's very normal. I'm doing exactly what I want you to do. You're starting to feel nice and relaxed. And that's a really important thing, especially when we're doing hypnosis. So I say all of that to say, if you're kind of like, I don't know if I did this right, or I feel like maybe I should have done things differently, or there's just something about it where you feel worried or stressed about doing the right thing, and I'm saying that in quotes, that you know that you are absolutely doing the correct thing. You are on the right track to do and enjoy the benefits of hypnosis. And so let's just start with a little, and I'll audio record this as well, a little mindfulness exercise just to get us grounded a little bit more. And so what you can do is you can start to just get nice and comfortable, and I'll record this. And go ahead and take a nice deep breath in through your nose and back out through your mouth. Noticing the breath, noticing where you feel that breath in your body. And we're going to take 3 nice deep breaths together. And as you breathe in, I want you to visualize the words I am. And as you breathe out, the word calm. So I am, and then calm. We're going to do these 3 deep breaths together. Breathing in. First breath, I am. Breathing out, calm. And again, nice deep breath in through the nose and back out through the mouth. I am. Calm. And then the third one, breathing in, I am. Calm. And as you take that last breath, let your body settle, whether you're in the chair or the bed or on your floor. Let the hands rest easily wherever they might feel best, and let the eyes gently close or soften. Taking another nice deep breath in through the nose and back out through the mouth, just noticing the gentle rise and fall. Inhale and exhale, like a slow tide moving through you. And now go ahead and bring your awareness to places in your body that feel supported. Feel the ground beneath your feet, the chair beneath your spine. Let yourself be held without needing to hold anything. And as you breathe, imagine a soft light forming just above your head. This light is calm, safe, steady. And with each breath, it begins to flow gently through you, down through the crown of your head, through your chest, warming your belly, softening your hands, flowing down to your feet. This light brings you back to yourself, and it reminds you, I'm here, I'm safe in this moment. My body and mind can work together with compassion. And I'd like you to go ahead and take one more breath in and gently breathe out, bringing this calm with you as you slowly return to the room, wiggling your fingers and toes. And when you're ready, open your eyes. And so now that we're back in this moment, you can stay sitting, getting nice and comfortable. And so again, the focus for today is really going to be on you just allowing whatever comes up for you as we get started with this. Again, your thoughts may come and go. That's totally normal. I'm going to walk you through the entirety of this. I want you to feel relaxed and at ease. And I'm going to audio record this again because for those of you that haven't done hypnosis before, to me, hypnosis is like riding a bike. The more you do it, the more benefit you get from it. So the more you practice this, I find the easier it is to make use of this and have those suggestions benefit you, because the more times you send these recommendations to your brain, the more your brain's going to suck up all of that good stuff and say, yes, this feels so good. I really want to utilize it. So go ahead and get comfortable, and I'm going to start audio recording. And to start, just find a comfortable space, knowing that you can shift around or move around throughout this practice and it won't disturb your concentration or relaxation at all. And just let yourself begin by taking a few slow, steady breaths. You're an expert at this already today. Breathing in comfort and breathing out anything that's heavy. Allow your eyes to gently close or soften your gaze if that feels more comfortable to you. There's nothing to do now, nothing to fix, nothing to manage. This is your time to simply be, to receive, to rest. Take another breath in, and as you exhale, let go of any tension you may be holding in your face. Feel your forehead smooth, your eyebrows soften. Unclench your jaw. Let your tongue rest gently in your mouth. And now bring your awareness to your neck and shoulders, allowing them to drop just a little further away from your ears, releasing any weight that's not yours to carry. Feel the muscles in your back and chest loosen. Feel the gentle rise and fall of your breath, soothing your heart, soothing your nervous system. Allow your arms to rest comfortably, letting any last bits of holding melt away from your hands and fingers. Bring that awareness now to your belly. Allow it to be soft, expanding naturally as you breathe. Letting go of the need to control or brace. Allowing your body to take up space. And feel this wave of relaxation move into the hips, thighs, down your knees, your calves, all the way to your ankles, feet, and toes. Your body is safe to rest now. Your body is supported. Your body knows how to unwind. And with each breath, you can let go a little more. And as you do, you'll notice a gentle warmth spreading through you. A calm awareness that you're being held, that you don't need to do anything to be worthy of this rest. And now I want you to imagine a soft, misty path in front of you. A path leading down into deeper stillness. This path is 10 steps, and each one takes you further inward, further into comfort, deeper into your center. And with each step, your mind quiets, your breath deepens, your whole system shifts into calm, healing stillness. Let's begin together. 10, stepping onto the path. You feel this earth strong beneath you. 9, you hear gentle sounds in the distance. A bird, a breeze, perhaps a river. 8, with each step you feel lighter, clearer, more relaxed. 7, any outside concerns start to fade away. 6, your body begins to float a little easy and weightless. 5, halfway down now, peaceful, steady. 4, your inner world becoming brighter, softer, more welcoming. 3, your heart steady, Your breath a quiet rhythm. 2, one breath at a time, one step at a time. And 1, you arrive now in deep calm, completely relaxed, completely safe. And in this calm state, your inner self begins to awaken. The deeper wisdom of your body, of your heart, of your soul. Let yourself rest here for a moment longer. There's no rush. This is your moment of beginning. You've entered a sacred place within, where healing is possible, where trust can grow, and where your journey can be met with compassion, strength, and hope. Bring your attention gently inward to the quiet center of your being. This is a place where all your parts are welcome. There may be a part of you that's hopeful, a part that's tired, a part that's grieving, a part that's holding it all together. Allow each of these parts to be seen without judgment. You might imagine them as figures, colors, images, and to each one, offer this message. Thank you. You're doing your best. Breathe into that. To the part that's scared, say you're allowed to be scared and you're not alone. To the part that feels pressure, say you don't have to carry this all by yourself. To the part that's hopeful, say it's good to hope. Hope is strong. And to the part that feels broken, say you're not broken. You're healing. You're whole enough to be worthy of love, rest, and joy. And imagine wrapping all these parts in a blanket of soft, warm light. A light that says you belong, you're healing, you're enough. Let them rest now inside your heart as you breathe gently with compassion for every part of you. Now gently turn toward the part of you that wants to feel more in control. And maybe sometimes thoughts start to race. Sometimes fear might take over. But you're learning and have the power to return to your center. Picture those thoughts, those fears, as leaves floating down a stream. You can notice them and let them pass. You might say, this is just a thought. I choose which ones I water. And bring to mind some sort of empowering phrase that you want to carry. Perhaps it's, I'm resilient, or I trust my timing, or I'm doing what I can and that's enough. And let your inner voice grow stronger. Let it be a kind coach, not a harsh critic. A guide who whispers, you can do this. You're doing this. And now take a moment and visualize yourself handling a difficult moment with grace. Breathing through it. Returning to your body. Saying to yourself, I've been here before. I've made it through. You're not at the mercy of your thoughts. You're building the power to respond instead of react, to pause, to breathe, to choose what nourishes you. And now I'd like you to bring to mind your own face. Visualize this now softly, gently. Imagine looking into your own eyes and seeing the woman who's walking this path. You've faced uncertainty. You've been strong in moments where perhaps you may have wanted to fall apart. You've shown up for appointments, for choices, for your body. And go ahead and place a hand on your heart now, not just in your mind, but actually do it. Place a hand on your heart and let yourself say, I see you. You're trying so hard. You're enough exactly as you are. You don't need permission to rest. You don't need proof to be proud of yourself. And right now, let your body receive this comfort like warm water or sun on your skin, a sense of deep relaxation, a soft letting go. Feel your breath deepen, your jaw loosen, your shoulders melt. Let this be a moment of complete release where nothing is expected of you and everything is allowed to be as it is. You're not behind. You're not wrong. You're exactly where you're meant to be. And now bring into your mind an image of your future self, the one who made it through, and the one who looks back with compassion and pride. See her standing tall, smiling, glowing with quiet strength. She's not perfect, but she's powerful. She's learned to rest when needed, to trust her body, to trust her choices, to advocate for her needs, to celebrate her wins. And let her walk beside you now, whispering, you're doing better than you think. This journey is shaping you, not defining you. You're becoming more of who you are. Let yourself feel proud of how far you've come, of your commitment, your strength, your softness. You're allowed to feel confident. You're allowed to hold both hope and truth. You're allowed to feel ready. And if doubt comes again, as it sometimes does, you'll remember, I'm on my path and I'm enough. And now I'd like you to visualize something else. Imagine yourself now standing in front of a full-length mirror. You can see every detail of yourself in this mirror from the top of your head all the way down to the tips of your toes. And you might notice that certain areas of your body are lit up with tiny lights, almost like Christmas tree lights of different colors. And in your head is a light that represents your thoughts. And if you go deeper still, in the brain is a light that represents feelings about yourself. And the throat has a light that's related to the way that you communicate with other people. The heart has a light related to feelings and emotions. And there are all other lights all around the body, some bright and some dim. And take a moment, you can really notice these lights so clearly. And these lights indicate any areas of the body or mind that have become a block or barrier on the fertility journey. And you can switch these lights off, you can switch them on. They're all controlled by your wonderful subconscious mind. And in a moment, we're going to test the lights one by one. And I want you to notice the color of each light, what that color means to you, and if the light is a strong one or not so much. I'll give you some time to notice each one. And so to start, make sure that all the lights are switched on. And take a moment to notice if there are any areas of the body that have a dimmer light than others. So for example, if there are dimmer lights around the womb, or dimmer lights around the heart. Just notice that. And now what I'd like you to do is visualize a part of yourself, a teeny tiny part of yourself, dressed in some sort of outfit, like you're going to work somewhere. You have a torch in one hand and a bag of tools in the other. And you're entering your own body, this part of you, this small part of you, and traveling toward where the dimmer light is. Perhaps that's your womb, your heart, your mind, wherever it is. Maybe it needs to go to a few places. Choose a first stopping point. And I'll give you a moment to get to that area. And once you do, go ahead and look around. Shine your torch and notice any areas that need attention and support given to them. You may notice a blockage, or you may just notice that there's something that's preventing you moving forward in this journey. You may just sense it. You may not know exactly what it is, but you know the part of the body that's impacted. And then take a good look around you and know that in your tool bag, you have everything that you need to rectify whatever this block might be. And your task now is to do whatever your subconscious mind knows needs to be done. That may come to you as a word, an image, a symbol. It may take a few times of practicing this to know what that might be. I'll be quiet for a few moments as you notice this. Allow your subconscious mind to do what it knows needs to be done for this area. Excellent. And now have this part of you come out from your body and take another look at those lights and notice any other weak lights. And you're going to repeat this process until all these lights are good and strong. It may be that you have to go to the control center of your body, wherever that might be, and reset some switches that were maybe turned off, that are maybe some sort of imbalance or a mechanism not properly working the way you want. But go ahead and take a moment and try this again. You can do this with as many dim lights as you need, but go ahead and try this again and just find the part that's dim and go in and just look at where it might need some support. And again, knowing that your tool bag has everything you need, do whatever your subconscious mind knows needs to be done. And once you've done this, you can go back to any other parts. And once you've done this with any dim lights, ask your subconscious mind if there's anything else that it needs in order to conceive. And you might even go to your control center and ask for some sort of image or symbol or date of when you know that you're going to take the next step in your fertility journey. And once you do, go ahead and project your mind into the future and imagine this next step already taking place. Noticing that next step, whatever part of this journey that you're waiting on, that you're ready to. And because you're visualizing it, your inner mind already knows that this visual will soon become reality. And because your inner mind knows and accepts that this will happen, any concerns or worries of the past will slowly begin to disappear, as the parts of your body or mind that need healing will be naturally strengthened as you begin to feel better and better. And in a moment, I'm going to count from 5 down to 1. And when I reach 1, you'll be awake and alert back in the present space, allowing that healing to commence at a deeper level of mind, and all systems and functions of the body and mind being restored to harmony. Slowly beginning to return to the space around you. 5, gently wiggling your fingers and toes and feeling the surface beneath you wherever it is you might be. 4, taking a deep, full breath in through the nose and back out through the mouth, and releasing it slowly. 3, letting yourself carry all that you've gathered here. Relaxation, healing, self-validation, strength. 2, eyes flickering. And 1, opening the eyes and returning with calm clarity and quiet confidence. You're exactly where you need to be, and you're doing it beautifully. And I'll give you a moment to come back to the present. And again, for those of you that joined during, or you felt like maybe you missed it, I've audio recorded all of these as well, so you don't necessarily need to go back through the entire video if this is something that you'd like to try and you feel that it resonates with you. We'll post all of these. So the brief meditation we did at the beginning, as well as this hypnosis recording. And again, like I said, hypnosis is like riding a bike. The more you do it, the more you're going to get the benefits. So I encourage you to listen to this whenever you feel like you could utilize this support for yourself. Again, we'll post it ASAP so that you have access to these recordings, because I think they're really beneficial on this journey that can be very hard and taxing. And so what does your homework look like from me? Continue to try to self-validate at least once this week. You can do this before bed, like we've talked about before. That can also help if you start to have like ruminating thoughts, or anytime throughout the day when you notice a situation where you find yourself engaging in that shame or blame type of language coming up. Again, aim to listen to this recording. The more you do, you're sending messages of safety and healing to your subconscious, which is going to allow all those parts that you may have identified in this recording that need healing to be reduced over time. So again, the more you send these messages to your body and mind, the more the body and mind start to connect and communicate that it's safe, that it doesn't need to release that cortisol. And then we see the direct relationship in order to find yourself able to better communicate and then reduce those physical symptoms of inflammation, physical tension, or pain. And so I thank you all for being here. You can reach out with any questions. I'm going to stay on if anyone has questions about practicing that self-validation or any other questions that I can answer on my end. I thank you all for being here with me, and I will make sure that these recordings get posted as well so you can utilize these. So I'll be here to answer questions if you have questions from the last couple of weeks of starting to practice self-validating, if you have questions about completing the chart. And I am so excited to do some more hypnosis with you all next week. I hope you have a great week ahead, and reach out if you think of anything, and we'll have some more time next week as well. Have a great day, everyone. Thanks, Christina. And if anyone has questions, feel free to put them in the chat. I'll be here for a few minutes if you're having any difficulty or you have questions about how you're integrating these tools. Yes, so Susan, it makes total sense for your mind to wander. And the whole point is that you don't have to bring yourself back. I'll bring you back when we count down and we bring back to the present. The idea is that actually we want you in that sort of trance state where you're moving from those delta to theta waves. So you're kind of getting into that state where your mind is wandering and thinking about other things, so that your conscious isn't trying to argue with the metaphors and suggestions I'm making. We're really sending it to that subconscious. So it makes total sense to me if your mind wanders. Like I said earlier, you don't need to bring it back. It's not like a meditation where you're supposed to try and bring it back and focus in on the breath. The idea is to get into that trance state so that you feel really relaxed. And if your thoughts start to wander, and then you come back. If your thoughts are wandering and you're finding that disturbing, or you're thinking about something negative, then I would say go ahead and try and focus in on something in the room that you can bring yourself back to the present for. So someone else asked how hypnosis is different than mindfulness meditation. So two totally different beasts. We could talk about this all day, but mindfulness meditation is really focused on the present and here and now. So when you're doing a mindful meditation, you're really focused on, the breath, bringing yourself back to the present moment and not thinking about the past. Both can induce an altered state of consciousness, but meditation really focuses on that cultivating mindfulness and awareness. Hypnosis is focused on getting you into that trance state so that you take the suggestions or metaphors that the person doing the hypnosis with you is giving you to achieve a specific goal or outcome. So really, meditation, the focus is on awareness, self-regulating attention. It's focused on that mindfulness in the present moment. It doesn't really involve specific suggestions. It encourages you to observe your thoughts and let them pass without any sort of attachment or anything like that. Where with hypnosis, we use suggestions or metaphors to guide your experience and help your subconscious mind process a certain goal, feeling, experience, leading to different outcomes in the future around something that you wanted to work on. So when I work with individual clients, I'll often focus on whatever goal they want to focus on. So it could be chronic pain, it could be working through a past trauma, it could be working on gastrointestinal distress. There's so many different specific things. Does that make sense? Excellent. I was like, how do I explain this in like a clear, concise way? So you tell me if it didn't make sense. Oh, good. Kelly, everything should be posted in Mighty Network. So I send these recordings to the admin team and they post everything. So all of the recordings should be posted. If the entire video gets posted and not these recordings, email our info email so that we can make sure and all of us can see that they weren't accessed so that we can make sure to post them. But all of them should be posted so that you have access to them. What I'll also say to Susan's question about the mind wandering also, what I've often noticed and I've gotten feedback from clients on is that when they've maybe done something with me in a session, but then they go and they listen to it on their own, you might actually have different responses, which I think is really interesting as the subconscious gets more used to doing hypnosis. So you may have had a hard time, and you may not even remember this, and that's okay too. When I asked you to visualize like a certain symbol or image, you may come up with one this time that's different than the next time, and there's nothing wrong with that. So if you have a different visualization or you see something different or there's a different word or phrase, all that means to me is that your body and your mind are working through it. Hence why we always encourage people to practice this over and over, because we see that you can get continued benefits. And I think that's really cool that you can use something and continue to see the benefits from it over a period of time. Any other questions for me? I think it really depends. I know for me, I like to do hypnosis later in the day, like before I go to bed, just because I usually feel like really relaxed afterwards. So I kind of just want to go to bed afterwards. I have some clients that like to do it in the morning. It also depends on the goal, right? I work in fertility and women's health, and I also work with like a lot of chronic pain and health psychology work. So depending on what the goal is, I'll have clients practice at different times. I do a lot of work in chronic pain, a lot of work in women's health. So if I have a client who's having like a flare up of endometriosis symptoms, I'm going to give them brief hypnotic tools that they can practice when they're experiencing pain. So I don't want them to just wait till they go to bed unless they're feeling pretty good and they're just practicing. But if I'm working with someone who's experienced a significant trauma, I might say to them, do it at the end of the day because I don't want you to be doing it in the middle of your work day and then have to go back to work. So I think it depends on your goal and how much time you have. If on a Saturday you're like, you know what? I could go for a little nap or I could go for some rest or I have this hour free, go ahead and do it during the day. So I think it's about your time and availability and how you respond. Some people tell me they feel super refreshed afterwards. I know for me, I often feel really relaxed and that makes me a little tired. So I like to do it later in the day, but totally up to you. The only thing I always say is don't do it while you're driving because then if you start to go into trance, we don't want anyone getting into an accident. And I have had one or two clients say, oh, I'd love to listen to this on the way to work. And I say, I don't really think that's a good idea. Great questions, everyone. Any other questions about this? Also, I will say if like after we get off this call and you're trying it out this week and you have more questions, we're going to do some more hypnosis next week. So email me, you can reach out to me. In terms of knowing if you're in a trance state, you've likely all been in it. It's basically when you daydream or when let's say you're in your car and you're listening to music and you kind of are like zoning out a little bit and you miss your exit when you're driving home. We've all been in trance states before. It's that kind of state where you're a little bit tired and you kind of are zoning in and out. Maybe it's like at the end of your work day. So we've all been in trance states before. A trance state with hypnosis looks different for each person, but often what I look for is you're aware of what's going on around you. However, you can still notice things without feeling yourself pulled to engage with them. So I know when I was being trained in hypnosis, um, they make us do hypnosis on someone and then they do it on us. So you do it back and forth. And when I was in a trance state, I could hear what was going on around in my house, but like there was a crash and I was really unaffected by it. I noticed it, but I was able to just kind of keep being in that state. So that's kind of how I assess it for myself. Um, for the question that you just asked, Suze, with uh, tweaking the actions, can you give me an example of something that you're I mean, you could certainly change it to something else as you're doing it, right? Like that's why I try and make it vague enough. So you can change the part of the body. Your mind might also change that. Maybe I said, maybe you notice like a switch needs to be reset, or maybe you notice that something else needs to be reset. What I want is for your brain to then say, you know what, but actually what I need is I need us to wipe this entire system, or I need myself to add this new panel in. You can absolutely do that. Is that what you're kind of thinking? Absolutely. Yes. And ultimately, that's what we want your subconscious to do. So that's why you hear me using words like you might notice or visualize this broader thing. And so when I say those types of things, it's because I want to give enough space that someone who is able to go into that trance and picture these things does what the subconscious wants it to do. But you have enough of a suggestion that you can also picture it. Susan, absolutely. Usually I tell people you might feel a heaviness or a lightness, or sometimes people say they feel a numbness. I know for me, I tend to feel very heavy in my arms and legs. So like I was once doing a hypnosis training with a colleague and I was the client and there was a big crash in the background, but my body was so heavy that I couldn't really do anything. But I think the problem is so many people think of hypnosis as like entertainment hypnosis you see where they make you quack like a duck or do something else. And I always say, I don't know where those people got trained. I was trained by the American Society of Clinical Hypnosis, and I cannot unfortunately do that. I would love to do that to my husband. I think that would be pretty cool. Don't tell him I said that. But I can't do those things. What we can do is we can relax our body enough that that conscious thought that isn't always super kind to us can actually go and bypass and go to our subconscious where we're holding on to all these worries and fears and start to shift them so that any of those subconscious blocks related to our fertility, related to other experiences we want to work on with hypnosis, we can start to shift and retrain the brain to not feel as negative about those or not shame and blame ourselves as much. I'll also be curious as all of you try this, to your point, Suze, of if you're trying it and like each time or after a couple of times your subconscious starts to fix other things, almost like it's working through different things that it's identifying needing to be fixed as you fix certain things. I think about similarly with like EMDR, eye movement, desensitization response that I do. Oftentimes we'll work on something and that leads to like another memory coming up that needs to be worked on. And sometimes I think like the body and the mind just need to go through this process of like, let me repair this. Now I'm ready to move on to this. Let me repair this next thing. Now I'm ready to move on to this. So I'll be curious to hear if you try it out, if you notice that your mind, your subconscious is bringing up different things that might have changed. Absolutely. Any other questions that I can answer? These were great. Thank you. Thank you all for being here. Absolutely. Well, again, thank you all for being here. Thank you for your thoughtful questions. I think it's so important that we talk about this and everyone has like a good understanding of this. So I appreciate you all staying on and asking, for those who might listen afterwards as well. Please let me know if any of you have other questions, and then I will see you all next week for some more hypnosis.